So to begin, I'll introduce myself. I'm Dr. Jennifer Bombush. I'm a professor at the UBC School of Nursing. I'd like to welcome everyone to our webinar, which is hosted by the UBC Research Excellence Cluster, Reimagining Supports for Children with Medical Complexity. You're invited to sign up for regular updates from the cluster by using the link in the chat that Isabel, our cluster administrator, will add. And a reminder to everyone that this webinar is being recorded. It will be posted on our School of Nursing YouTube channel, like all of our other webinars from the cluster, to be viewed at a later time, and we will send out that link when it's ready. I'd like to begin by acknowledging that the UBC Vancouver Point Grey campus is located on the traditional ancestral unceded territories of the Musqueam peoples, with work sites located across the shared territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. The UBC Okanagan campus is situated on the traditional ancestral unceded territory of the Syilx Nation. If you are joining from other territories, please acknowledge the traditional owners and caretakers of those lands. Do this as appropriate to your specific location. You can learn more about the Indigenous land you are on by visiting the online resource native-land.ca. And we will put that link into the chat for you to look at. Today's webinar is the Future BCCH Center for Health Complexity, Information Sharing and Q&A, presented by Tamara Crozier and cluster member Tessa Diaczun. Tamara Crozier is the Provincial Director of Specialized Pediatrics Health Complexity at BC Children's Hospital. Over the past 10 years, Tamara and her team at BC Children's Hospital have led province-wide initiatives focused on improving the standards of care and community for children living with medical complexity. As a registered nurse, Tamara's mission is to transform health services so that children and families receive the right care at the right time. Tessa Diaczun is a pediatric nurse practitioner with 20 years of experience caring for children with health complexity. She is the clinical planning lead for the SLOCAN site redevelopment project, while also continuing to practice at BC Children's Hospital. She holds an adjunct professorship at the UBC School of Nursing and is grateful to be involved in the Thriving Kids cluster. And we are very grateful to have her. So today's session is set up as a webinar, and I will be facilitating discussion throughout the presentation. So I'd invite people to use the Q&A. For most of us, it's at the bottom of our screen, sort of in the middle of the group of options, and it says Q&A. And if you put questions in there during the presentation and following the presentation, I will facilitate the discussion. And so with that, I will hand it over to our guest speakers to begin their presentation. Thank you so much.
I literally just lost audio. Can you hear me?
Yes, we can.
Good. I assume that you were passing the mic to me. Okay, so I'm going to go ahead and share my screen. Is that okay? Yeah, perfect. Okay. And all right, can I get a nod from Tamara if that's working? Okay, excellent. Hi, everyone. It's really nice to have you all here. I see lots of familiar names in the attendees list, so I'm excited to be sharing this with some new people and others who've heard about this project before. So I just want to get us started with an acknowledgement of where our project team works and where this new Center for Health Complexity is being built. Jennifer acknowledged the lands of UBC, and I want to acknowledge that this project is happening on the unceded traditional and ancestral territories of the Musqueam, Squamish Nation, and Tsleil-Waututh Nation. We are mindful in how we do this work as we progress this project forward on these lands, working closely with partners, including Indigenous partners, and leaning a lot on our Indigenous health colleagues at Children's and Women's and PHSA, really aiming to move this work forward in a safe, culturally safe way for future patients and families, as well as staff. So here's our agenda. We're going to give you a bit of a project overview, tell you a little bit about how we do our work for the project, make sure that we're clear on who we're designing for, and who we're designing with. And then we'll jump into the actual new service model that will exist at the Future Center for Health Complexity. We have a patient journey if time permits, but if there's lots of questions, we're also okay to just jump into the questions because it's really just reinforcing what the new service model is. So we'll kind of see how we're doing at that point. And with that, I will pass over to Tamara to get us started.
Great. Thanks so much, Tessa. And thank you, Jennifer, for the introductions and for both Tessa and Jennifer opening the session in a good way. I'll start, first of all, we'll start with saying I would like to begin by thanking everyone for your interest and taking time out of your busy day to join Tessa and I as we share the exciting work underway to develop a novel center focused on the care of children living with health complexity and their families. The new center is being built on the former site of Sunny Hill Health Center located in East Vancouver at East 21st and Slocan Street. Sunny Hill occupied the site for many years and moved into a new and purpose-built facility at the main Children and Women's Oak Street campus in 2020. This move created an opportunity for BC Children's Hospital to redevelop the site. Construction is currently underway, and this innovative, purpose-built facility is planned to open in early 2028 and will offer services both on-site and virtually. Next slide. The journey in the development of a center and programming for children living with health complexity started in 2018 through visioning sessions and concept development that culminated in a business plan that was approved by the Ministry of Health and the Provincial Treasury Board in spring of 2022. Since that time, a lot of work has taken and continues to take place, such as service model design, receiving development and building permits, demolition and site preparation, detailed design, and construction that started earlier this year. Construction will be completed in late 2027, with the center opening in 2028. Next slide. This is really to talk a little bit around how we work. So as you can appreciate, it takes a team to make the vision a reality. Key to this project are the project sponsors and portfolio leaders to realize its success. This team, that includes Executive Vice President Susan Wanamaker, Chief Operating Officer Sarah Bell, Executive Directors Christy Hay and Ruth Apanaw, and the medical leadership of Drs. Hal Seiden and Tom McLaughlin, provides support by championing the project, ensuring strategic alignment, providing guidance, and high-level decision-making as just a few of the responsibilities they fulfill with this project. I can tell you that the clinical and operational project teams are grateful for their expertise and support. Next slide. Foundational to this project is ensuring a purpose-built facility and programs that meet the needs of children living with health complexity and their families. This means designing with and not designing for the new model of care and the design of the new center. In fact, 7 families from our patient and caregiver advisory group will be touring a warehouse in South Vancouver today to finalize a design of 3 very key spaces in the building. These families and caregivers will test and provide guidance on furniture that works best for their children and families. Our engagement to date has taken many forms, and we have worked with many different groups that include patients, families, and caregivers, children and women's frontline clinicians, operational leaders, and Indigenous health, as well as community clinicians and partners and government ministries. So here are some of the examples of the ways that we've engaged with these different groups. Our patient and caregiver advisory group, comprised of 10 to 14 caregivers, many of whom have worked with us since the beginning of the business plan phase, are incredibly invested and critical to our work. Frontline clinical providers and leaders across BC Children's Hospital, staff from partner agencies, and community across different health authorities and sectors have informed this work. We have run dozens of workshops and working groups, held physical mock-ups at the family suites area of the new building, and facilitated virtual tours of the new center. Slide. Our team has worked in partnership with Children and Women's Indigenous Health around planning of the services and the new center. There will be several Indigenous-focused spaces, including All Nations Space, Elders Room, and Healing Garden. Elements of Indigenous art, design, and wayfinding will be woven into interior design and strategy. Next slide. This shows a summary of our clinical planning process to date. As you can see, the business plan, approved by the Ministry of Health and Provincial Treasury Board in 2022, completed this phase of the project. Informed by vast engagement and other activities such as environmental and literature scans, a first draft of the service model design is complete. Currently, we are well into the operations planning for the new center and are working closely with leaders at Children's and Women's with human resources planning, as well as development of policies and procedures. Next. So now we'll define our population. Next slide. So when we speak about children living with health complexity, we are referencing a population of children who have significant multi-body system chronic conditions, who have functional limitations that require significant support with basic functions and daily activities, and are often technologically dependent. These children have substantial healthcare needs and depend on parents, caregivers to have specialized knowledge and skill to care for their child. These children have frequent use of health and social systems supported by multiple professionals in and outside of the health system involved in their care. Children with health complexity are living longer due to advances in medical care and technology. These children represent less than 1% of the pediatric population in BC, but up to 33% of health provincial spending and account for more than a third of pediatric hospitalizations. The center is designed to serve the most complex 2,500 children in BC and Yukon, while offering resources to a wider population of approximately 9,000 children. The center will also provide support for the whole family, including siblings. So now I'll hand it over to my colleague Tessa, who will walk you through the service model being designed to support children living with health complexity and their families. Thank you.
Thanks, Tamara. Okay, so these are the three key services that I'm now going to walk us through. And what's really important is that these new services that will exist at the new Center for Health Complexity are services that are not duplicating existing services and supports in our system. They're really addressing really well-known gaps that exist for children with health complexity and their families. There's been a lot of work done, parent voice, caregiver advocacy, national reports, international reports, child and youth representative reports that have guided us in really addressing the gaps in the system. But we know that there are some key gaps, and that's why these new services will exist at the new center. What's really important is that while we're building this amazing new center that is going to be beautiful, and so excited to be having these mock-ups happening this week, and I'm going down to see the families that are visiting this afternoon in South Vancouver. So the new physical space will be amazing and purpose-built for this population and their families. And so, of course, services can be delivered in person, both on an inpatient basis, which I'll tell you a little bit about, as well as an outpatient basis. But really importantly is that some families will probably never move through the front doors to receive service. They will receive their services virtually. And so those three key services, care coordination, family wellness and support, and training and education, which I'm going to tell you more about, are really being designed to be delivered virtually. So that means that the way that the service is being designed is being designed in a way that we know virtual delivery will happen, as well as hybrid. So some in person, some virtual happening at the same time, depending on where folks are in receiving that service. But we're also thinking about the space design in the new center so that the virtual experience is a good one, both for the professional that is providing the virtual care, as well as the family, caregiver, or professional and community that is receiving it. So the first service that I'll talk through is the care coordination service. And really this is foundational to the new center. So the care coordination service it has some sort of key elements: individualized, family-centered, and longitudinal. So I'll just kind of walk through what we mean by those things. So when we say longitudinal service, we really mean that this service follows children and youth across their pediatric journey. There's not intended to be a referral and then a discharge and then a re-referral at a time of need and a discharge. There's an anticipation that given the multi-system chronic health conditions that these children have, there are periods where care coordination needs are really active and busy, and then there might be times where things are more quiet. And so that knowledge and understanding is built into the caseloads and the way that the service is designed. We also want the service to be family-centered and really relational. So thinking about developing trust over time, developing a relationship and getting to know the child and family over time, knowing that trust doesn't happen after one interaction, that relational care really is a process and a journey that can evolve over time with getting to know people. The individualized care really means that we're focusing on the unique goals, needs, and strengths of an individual child and their family at any given time. Depending on where you live, depending on who your family and community makeup are, depending on lots of different factors, we all know that experience of care is different. Depending on where you live in the province, you may have access to a very different care team than if you live somewhere else. And so we know that providing a one-size-fits-all care coordination service won't work, especially across a large area of BC and Yukon, which this new center will support. So having an individualized, tailored service is important in terms of thinking about sort of those foundational elements of the care coordination service. There's a couple other kind of key pieces to this care coordination service, which is the after hours support line and electronic care coordination tools. So just really briefly, the after hours support really is intended to continue the care coordination service into the evenings and weekends and on stat holidays. So daytime hours, it will really be the care coordination staff that will be available to address needs from children, families, and folks in community. But during those after hours and weekend times, there will be a nurse-led after hours support line that people can call into for non-urgent, non-emergency support, but time-sensitive care coordination needs. So that's a really important piece and something that is really clear in the literature and environmental scan as being a real value to this population. And then in terms of electronic care coordination tools, this is a work in progress. The landscape of technology in the province is evolving and complicated, but suffice to say that we know that in order to do this work well, we need some tools to be able to do it efficiently. And in order to keep track of a large number of children and make sure that services are provided in a transparent and efficient and equitable manner, we need to have some systems in place to support staff in their communication, collaboration, and continuity of care. So we're in the depths of working through what exactly that can look like. We will be using the electronic medical record for documentation that is at BC Children's Hospital, which is Cerner. But we're looking at add-ons or adjustments in order to sort of bolster the care coordination tools. So I'll talk a little bit about the staffing model for the care coordination service because people are always curious about that. So before I dive into this, I want to acknowledge that lots of care coordination happens across sectors currently. So there's lots of people that are doing care coordination. The challenge for children with health complexity and their families is that oftentimes the people that are supporting care coordination are either doing it off the side of their desk or out of the kindness of their heart. And that's inequitable because that doesn't exist for every child and family. The other piece, though, is that there's a range of different people that are doing this work, and the communication and the collaboration systems between them continue to be really siloed. So even when there is somebody in a child and families team who is keen and willing and attempting care coordination, there are system barriers that prevent that from happening well. And so this care coordination service is attempting to sort of tackle some of that and make sure that all children and family in that population of approximately 2,500 children and youth with the most complex needs across the province and territory have consistent access to care coordination. So who will do that? So we're talking about this as a navigator triad. So you'll see here in these circles is a nurse navigator, a social work navigator, and a new role that for now we're calling a logistics navigator. So that logistics navigator is a person who's a little bit of a blend of sort of a booking clerk, who's supporting appointment coordination, both at BC Children's Hospital, but also potentially outside of BC Children's Hospital. And then also this role that we see in communities that is highly valued of a family support worker. There's lots of different names for it, but suffice to say that not all families have access to these amazing people in community. And this is really around signposting, wayfinding, navigation around community-based services, and less so the health services. So the nurse, social worker, logistics are intended to work together as a team, acknowledging that there is role overlap, but also clear scope to support individual children and families across their longitudinal care coordination journey. For each 3 triads who have a caseload of children and youth that they're working with, this grouping has access to a medical staff, a nurse practitioner or a physician, a dietitian, and a pharmacist. And that's important that not all children need or will access these folks on a regular basis. There are some children who already have a dietitian, or they're followed by a feeding clinic, and another dietitian is not needed. But there are some who fall through the cracks, who don't qualify for being followed by a feeding clinic, or whose region doesn't have a pediatric dietitian. Same goes for pharmacists. So we know that most folks have access to a pharmacist in community, but the knowledge and capacity of those pharmacists in community is limited. And given the huge polypharmacy, or the huge laundry lists of medications that many of these kids are on, this is a really valuable role in the system. And so really these 3 people, dietitian, pharmacist, medical staff, these people are available to support and collaborate with the navigator triad. They're also available to support and collaborate with community-based professionals, but they're also available to meet with children and families when that need exists. Now, supporting this grouping of the navigator triads and the care coordination team are these other consultative supports and other services, which I'm going to tell you more about. So there is the interprofessional family wellness and support team, as well as the interprofessional training and education team. So these 2 teams are really going to be a resource to the navigator triads and the care coordination team and the children and families on their caseloads. But they will also provide a lot of offerings. So right now in the system, oftentimes health professionals tell us that they're willing to do the care coordination. They're willing to support families in navigating this mess of systems that they have to navigate, but they have nothing else to offer them. So they sort of hit a wall when it comes to new services and supports, because there's only so much you can do in the system where there isn't actually more services available to offer to children and families. So these 2 new services, training and education, family wellness and support, I'll tell you more about now. And really are aimed to increase the number of offerings within the system. I will call out specifically to Indigenous health. I'm not showing them scattered throughout all of these diagrams because we really envision Indigenous health staff existing throughout all of the services. So I'm simply showing them once on this slide to really show that the Indigenous health staff will be scattered sort of throughout the new program, and also working closely in continuity with Indigenous health at BC Children's. Okay, so let's talk about the training and education service first. So this really is a service intended to increase the confidence and capacity of families, caregivers, health professionals, the broad group of people that support children with health complexity in communities in which they live. Really, this is intended to increase capacity closer to home. so that families, if they don't want to travel to Vancouver for all of their services and supports, they don't have to. We know that right now there is education that happens everywhere across our system, at BC Children's Hospital, in community, by a range of professionals. And that education is often really targeted to an individual child and family and is often excellent. But we also know that there are big limitations to the way that training and education happens in our system currently. And so sometimes there isn't capacity to offer training to more than 2 caregivers, for example. And so when it comes to a particular technology, you have 1 or maybe 2 caregivers in community who are trained, and then they are responsible for educating others. And that puts a lot of stress on families, but it also leads to this challenge where you have a lot of different people providing different training for on the same topic. So really the need is to build confidence and competence across sectors, not just within the healthcare system and not just for patients and families themselves, but for the other people in community that are supporting them at home. So the actual topics will be broad. We did several workshops on this and held a working group on all the different topics that are really key and critical for this population. And they range from more medical topics like tech dependence, like GJ feeding and other enteral feeding and respiratory care, really to more functional topics like managing complexity, presenting to an emergency department, working with school-based teams. So thinking more about just like day in the life functioning and caring for a child with health complexity. So those topics we imagine being built up over time, and the way that those topics will be or content on those topics will be delivered will be also arranged. So virtual and in person or hybrid. And it will range from things like web-based content to group-based offerings to really highly individualized teaching and training for one particular child, or a group of professionals about one particular child. So let's just say, for example, group home staff that are needing to get to know one particular child, and there's a range of topics that need to be covered with those staff. Over time, hopefully these training and education offerings will be built up, and we have a team of people dedicated to doing that work. So the multidisciplinary team that will work within the training and education service, their job will be to identify, develop, and deliver this range of training and education offerings, and then to be responsive to needs as they evolve over time, to make sure that we're identifying the right topics, evaluating them, and developing new ones or making adjustments. Okay. The Family Wellness and Support Service is that other interprofessional group that is available to that care coordination team, if you remember from that other slide. So this service is really intended to address the emotional well-being and social connection needs of caregivers and siblings of children with health complexity. And that's really recognizing and acknowledging the very long journeys that caregivers and siblings are on in caring for a child with health complexity. And those challenges range from isolation to grief and loss to medical trauma and so on. And this is very well known for this population. And so being able to create a service that directly addresses the gaps, but also the needs within this population is really important. So like I said, this service will be specifically for parents, caregivers, and siblings of children with health complexity who are followed by the new program. I told you why this is so important already. This will be, again, like the training and education service. It'll be an interprofessional team, this time a counseling team, as well as peer support staff, really acknowledging the important role that people with lived experience bring to supporting caregivers and siblings of children with health complexity. So it will be that interprofessional counseling team and peer support staff that are identifying, developing, and delivering various offerings. And again, those offerings will range from virtual, hybrid, in-person offerings, and be web-based, group-based, or individual counseling. And really, the Family Wellness and Support Service is focused on the experience of caring for a child with health complexity. Okay, so the last piece I want to talk about before we pause and see where we're at in terms of questions is child and family suites. So a lot of people hear about this new center and they know about the spaces within the building, and they kind of think that it's all about the child and family suite, which is the area of the building that a child and family could be admitted to. But really, this is a place in the building that those three key services can be delivered. So care coordination, training and education, family wellness and support. This is just simply a place in the building where patients and families can come to access those services and supports. But it is a really unique space that I want to just tell you a little bit about. So these child and family suites, there are 16 of them. They are intended for short planned, non-acute stays. So families will we know that there are needs for this type of space through transitions. And so that might be a hospital to home transition, or it might be a home into an increased level of support, but not needing acute care hospitalization. So right now, as many of you know, in community, if there's a tech need or a training and education need, or even a monitoring need, the only place in the system for these kids to go often is into acute care. And sometimes that's not needed. It's not actually acute care that is required. And so this offers both a step up and a step down from the acute system and from home. So when, oh, I didn't include the other slide, so I'll just stay here for a moment. So these 16 suites are really unique in the way that they're designed. And this is the space within the building that families are going to see today. We have fully constructed mock-ups, which means that it's like the full thing with drywall and equipment and sinks and fridges and things and equipment. So this space within the building has each child and family suite, 16 of them, has a caregiver side and a patient side. So the child or patient side looks a little more like a hospital room. It has a ceiling track lift, it has wall oxygen section, it has a sink and a fridge and various pieces of furniture and storage. On the caregiver side, it looks much more like a hotel room. It has space in the room for up to 5 family members to stay comfortably, and shared between the two suites. There's a sort of a sliding barn door between the two sides, and between the spaces is an ensuite washroom that's fully accessible, and the ceiling track lift enters that space. So the suites are really designed to be comfortable, non-hospital-like, and really designed to have caregivers come and stay with children so that care coordination, training and education, family wellness and support can be delivered. The staff at the site will include people like physicians and nurse practitioners, nurses, patient care aides, and then the range of support services that exist at hospitals like housekeeping and food, people who work in food service, etc. And within child and family suites, there are a range of really amazing shared spaces where families can relax with their child, access those key services that they're there for, but also connect with other children and families who are staying. And those are both indoor and outdoor spaces. So that's the suites area of the building where care coordination, training and education, family wellness and support can be delivered in person in a more sort of intensive in-person way than maybe it would be if those services were being accessed virtually. Okay, so that's a whirlwind. We've said a lot. I'm going to pause for a minute and see if there are lots of questions, because I do have a patient journey that we can go through, and I think like time is pretty good, but if there's lots of questions, then we can just jump into questions as well. So Jennifer, I'll just pause for a moment.
Thanks, and thanks so much for your presentation so far. I'll just give a minute for people to post some questions. I have a question though. Big surprise. I have a question. So one of the things that families and children with health complexity experience a lot of are gapping chasms between supports from health, MCFD, and education. And you've sort of talked about at the very sort of micro level that there will be some engagement between this care coordinator, and people from other areas in the community that are involved with a specific child's needs. But I'm wondering at sort of the macro level, have you been engaging with, you know, policy people, decision makers from those other ministries to see if some of those chasms could be smoothed out at a more systemic level, as opposed to leaving it to figuring out every time there's like a crisis for an individual family? Because this is where I think, so many families struggle, in that we have great support maybe from the healthcare system, but none of it translates beyond the doors. And you get into this classroom and they're like, well, we don't know what you're talking about. We can't help you. We can't help your child eat while they're at school or use the bathroom or whatever. So at a more systems level, is any work happening to address some of those gaps?
Yeah, great question. Tamara, I'll start and then I'll pass to you to speak to the more system piece. So I guess the beginning answer to your question, Jennifer, is that the staff, so the care coordination staff, their job, their actual day-to-day job will be to be addressing cross-sector care coordination. So rather than, I mentioned that there's lots of people who do care coordination currently, but really their job is to coordinate care in relation to the service they work within. So if you've got a great neurology nurse that is helping you out and supporting some care coordination, really their job is to work within that silo of neurology, right? And even though they might intend to cross sectors, and sometimes they do, it's not built as part of their job. So having a care coordination service that is multidisciplinary and have it be their job, that they are to work longitudinally with children and families, and to communicate and collaborate across sectors, I think is a really important start, because some of this is about developing trust and a longitudinal relationship to be able to work with families around what is important to them, which often involves crossing sectors. So I think that staffing team is, although not very, maybe not very exciting and like earth-shattering, it's critical, because it's really that like individual to listen and hear and understand the journey and the trajectory, and then to support that navigation. Stepping back and zooming out to the more system piece, we have engaged with folks across sectors, and I see some people online today who are attending that we've worked with, and we continue to do that, and really know that like to create multiple separate services across sectors, or more separate services across sectors, is not helpful. We absolutely must be working together, because otherwise we're just making a complex system even more complex. Yeah, Tamara, do you want to add anything from a system level?
Yeah, actually, and thank you for asking that question. Actually, and thanks, Tessa, for talking about the work that we are doing at the level of sort of more systems. What I can share is that myself and our team actually has opportunity to meet on a regular basis with not only the Ministry of Health, but also the Ministry of Education, Childcare, and the Ministry of Children and Family Development, for which issues that focus most specifically on children living with health complexity of families are certainly forefront. So there is, I mean, I don't want to speak on behalf of everyone, but at least from my perspective, there is certainly a commitment and a desire to work across sector to create a seamless system for children and families. So thank you for bringing that question up, because I know it's an important one for everybody.
Thanks. I have a couple more questions. One from the Q&A is just wondering about how other allied health will be integrated in the center. I'm thinking OT, PT, etc., who provide a lot of support to children with health complexity.
Yeah, great question. I'm going to just share this again so that people can access this QR code. So just, sorry, bear with me 1 second. Share. Yeah. Oh, geez, it went right back to the beginning. Okay, that's okay. I'll get there. Okay, so yes, absolutely. So when I said the interprofessional team in both child and family, sorry, there we go. I'm trying to multitask. I'm not good at. So when I said interprofessional team for training and education and family wellness and support, those are the places where that interprofessional group will include folks like OT, PT, speech, behavior therapy, diet, and then we have dietitians and pharmacy, of course, within the care coordination service. Quite a number of them. So the most, let's say, staff intensive team of the new services is care coordination, because it's the navigator triads, nurse, social worker, logistics, plus the dietitian, med staff, and pharmacist for each of the 3 triads. So that's the most staff heavy service. And then training and education, family wellness and support will have a range of people. So in the family wellness and support, it'll be a counseling team, but we haven't been prescriptive about exactly who that will be, but we know it will be people like psychology, social work, potentially nursing, spiritual care, registered clinical counselors, and potentially others. So acknowledging that team-based care approach. And then the expertise of that interprofessional allied health team in developing training and education. So there are a lot of topics that are really squarely within the scope and expertise of occupational therapy, let's say. And so as a result, we've sort of we've outlined the number of staff within each discipline to sort of reflect what we heard from families about the topic areas that are most critical. And so overall in the center, the dietitians, pharmacists, nurses, and social workers will be quite robust. And then there will be the rest of the interprofessional team throughout training and education, family wellness, and support. I didn't get into all the details. I mean, I could go on and on, but within within child and family suite, so that area of the building where families can come for short plan, non-acute stays, the team I mentioned, like the most responsible provider and peer physician, nursing, patient care aides, but there will also be this team of people that we're referring to as sort of the recreational team, and that will be people like child life and rec therapy, and music therapy, and other people who really are designing developmentally appropriate engagement and opportunities for children with health complexity while they're staying within the suites. So there will also be a team within that environment as well. But the site is not duplicating care existing in our system now. So it won't be acute care, that'll stay at BC Children's. It won't be pediatric rehab care, that will stay at Sunny Hill. Although there's a recognition that there's lots of sharing across these sites as these children transition across settings of care. Hopefully that makes sense.
Thank you. Yes, absolutely. We have another question in the chat, and I'm going to layer into it a little bit because this is an area I'm really passionate about, as you know. The question is, at what age will services end for children and their families? And I'm going to layer into that, how are transitions from pediatric to adult health services going to be supported for people graduating from the center? And one of the things that kind of flagged for me during your presentation was mentioning Cerner. And knowing that these kids are around the province, one of the biggest issues for them is they've had significant specialized care, outpatient and inpatient, and you go to your health authority and they have zero documentation on your child. And it's
Totally.
your child is a fresh person. You have to, and talking about trauma-informed care, you have to tell your story again and again. And a lot of times people working in the adult system just don't understand the level of complexity. They think they do, which can make it challenging to work with them. but they don't. And it's a huge health risk for these kids as they're transitioning to adult services. So, what is the plan around health transitions? And, and is there going to be like a really tight handoff? Or is it still going to leave families, falling into that chasm at the time that that child has to transition to adult services? And I guess attending to that, sorry, one extra thing is that within BC Children's Hospital, there's huge variations around when the medical specialists discharge these kids from service. It can be anywhere from the age of 16 up to 18, 19. So will there be a policy around complex care that sort of standardizes so families understand when that child is going to transition to an adult specialist? Or will it continue to be sort of this very variable individual doctor decision?
Yeah. Okay, so there's a few pieces that I want to speak to, and then Tamara, jump in once I'm done. I want to comment specifically about this, like showing up in the health system and having to retell your story a million times, because I didn't speak to that exactly. But one of the really important roles of the navigator triad will be to work with families around their goals, and then to develop, I'm gonna call it the sort of, again, the sort of non-exciting the stuff of this work, but that's the reality. Sometimes it's not. It's really basic, and it's a care plan, and it's having a care plan that reflects the needs of the child and family and the location of care that they're going to, whether that be the school or a servicing community or a swimming program or the emergency department, right? And having a care plan that is individualized and responsive, and aligns with their goals and priorities. So that work of developing a care plan, as unexciting and boring as it is like we hear from families all the time. Like we're not asking for a lot. This is a pretty low bar. But having staff whose job it is to support families in identifying those goals and create care plans to ease the communication and collaboration across sectors where systems like Cerner fall short. Because as much as we would love to, overhaul that whole system, that is not within the scope of our project. There will continue to be gaps. The province is making progress with Health Gateway and other things, patient portals and things. But the reality is that these kids are going to continue to go through and see those chasms and gaps in our system. And so the care coordination service walking alongside is intended to be able to support that communication collaboration across. In terms of that specific transition of pediatric to adult, there's lots of transitions that we want to acknowledge throughout care coordination. One is starting school. One is a transition home from a NICU stay. Like there's lots of these transitions that are critical. But we know that pediatric to adult transition is one that has plagued the health system for this population forever. I've heard about it for the last 20 years since I've been a nurse. And it continues to be a challenge. And you're right, like every subspecialty has a different role, has a different person they hand off to, depending on where you live, you get a different service or you don't. There is nobody to hand over to, and your GP or NP ends up being the person. So it's really varied. So ultimately, the strategy is, I guess, a couple of pieces. One is to look at an age cutoff, and this has not been absolutely written in stone yet. A lot of this has to do with Ministry of Health funding and decisions that are upcoming. So what we are proposing as sort of best practice to support pediatric to adult transition is to have an age cutoff that is a bit higher. Let's say 24 is sort of what we're looking at. And that is looking at the context, the lay of the land in BC and Yukon. So we look at all of the different services and supports between MCFD, school, and health, who have all these different age cutoffs for different services. And 24 is kind of at that space where most of those transitions should have happened by then. So to be able to support a family through that arc could be very helpful. The other thing is that STAD, I'm going to forget what that's called, but somebody knows, probably most of you know, that's not available to everyone, but for those that it is available, I think having what we have heard from them and from families is that having a navigator triad be able to work with the STAD navigator to support transition. They're not healthcare providers with expertise in health complexity. And so their ability to support that transition is limited. And so having another partner in that process could be really helpful. And then also having somebody from within BC Children's Hospital, because the new center will be BC Children's Hospital, to work with individual subspecialty teams. I will not promise that every single subspecialty physician is going to discharge at the same time and be, proactive in the way that we would love everybody to be. But there will be now a team of people who are in an anticipatory way working with families around transition and making sure that they're connected in an individualized way. Lots of families are very capable, more capable than I am, of navigating this transition. Other families have absolutely zero support and need a lot more. So I think having a one size fits all approach to transition or thinking that it's simply having a tick box, like a checklist to say like we did all the things is not sufficient. It's not like we have those checklists and families still fall through the cracks. So having the staff and the checklist and that intention to ensure we did a lot of work around like what does secure attachment look like in the adult system? What does that look and feel like? Some of your work, Jennifer, also led into that. And how can we make sure that that happens in the adult system before a full discharge happens? So it's not a perfectly clear black and white answer, but we have staffing that will be attending to best practices around pediatric to adult transition specifically, as well as this care coordination service who should have and within their job description have capacity to sort of follow that arc into adult services. Tamara, do you want to add anything to that ramble?
No, I actually think you did. I think you've covered it all. Thank you so much, Tessa. It was such a great answer.
Yeah. I'm going to ask 3 very related questions. We only have a few minutes left, so I'm not going to layer anything into this because they're great questions and they have to do with remote and rural living. So I'll ask them all of them and then ask you to respond. So the first one is oftentimes families in remote areas don't have enough or any skilled people in their communities to help them care for their children in their communities. Is there any thought to how the hub can support these families? Question 2 is there are some children discharged to remote communities requiring supports like wound care or it says CADD pump administration and specialized injections that need to be administered. And oftentimes there are no community supports to support these families. Is there something that could be supported through this hub? And the third question is, will the care coordination be divided into regions for the coordinators to have deep knowledge of the complexities of organizing care away from urban communities and the differences between capacity and resources of different rural communities? So those are the 3, and I think that's pretty detailed. So perhaps you could spend a couple minutes speaking specifically to how the center will support those families living in rural and remote areas.
So I'm going to start with the last one first because the first 2 are related. So the last one is about what we are talking about as like regionalization of care coordination service. So when I say that, I mean that each navigator triad, nurse, social worker, logistics, will be paired with children and families who live in one geographic region of the province. And the intention there is that if you are working with children and families who all live in the West Kootenays, you are working with the same people a lot of the time. So you get to know the pediatricians, you get to know the child development center, you get to know the folks in the school system, leadership. You get to build networks and connections, and you become more familiar with the services in those areas, as well as the logistics of like travel. Like, what does it mean to travel from Nelson to Vancouver for an appointment in the middle of the winter? I know because I grew up in that area, but not everybody has any clue what that would actually entail. And so there's a lot of assumptions made about care and how it should be delivered because of that. So absolutely, the intention is to have that regionalization, and even better, what we're talking about, aiming for, hoping for, is to have some of those folks from the care coordination service actually embedded within community. So maybe having one of those people, one of the navigators, social work, nurse, or logistics, actually living and working in a region, and then have other staff who are at Children's, and they're working together as a team, but one person is not physically located at the new center. So we know that that brings a lot of value, and we've heard from families what it means to have somebody who actually gets it because they live in the community or they work with the people. And so being able to achieve that regionalization, I think at the very least, having a caseload that is representative of one region is really important. I mean, I've worked in a program where I had to know people across the province and Yukon. And I mean, it's really hard. It's almost impossible to really understand that landscape of care. And then the answer to the other two questions is yes. So absolutely, the training and education service, that is what it is designed to do. So it is designed to identify the needs. So let's say there is a particular medication or medication delivery system, like a CAD pump or injection, that teaching and training is needed around. It might be simply connecting with the service that is prescribing that and making sure that that training and education happens, or it might be actually designing and delivering the training by the staff from the new center. That might involve reaching out into community and working with staff in community to provide that training. It could be bringing those staff on site during an admission to learn and receive that training, or it could be a hybrid virtual approach. There's also a way of delivering education that we learned about through Ontario called connected care. And so we're building off of that model, which means that we would have some virtual or asynchronous learning, let's say for a group, for a group of respite providers or a group home, or even just friends and family that are willing to learn a few more skills to support a family. And they could attend that learning virtually or asynchronously, and then have sort of an in-person virtual experience with a simulation kit that is sent out to them. So let's say it's around G-tube care, that they actually receive the stuff in the mail. They do the session live with an educator from the new center, make sure that the care and the teaching is individualized to that particular child and their particular context, because maybe they don't have access to interventional radiology if the kid has a GJ tube and it's not possible to have, that type of service. So really individualizing that training, and being able to build capacity within communities is 100% the point of training and education. I will say, like with a caveat, that we heard about a huge range of topics and offerings that would be valuable. On day one, all of those offerings will not be available. But the intention is to have staff whose job it is to design and deliver those offerings and grow that service over time, so that we do have a robust set of offerings that, every once in a while there might be a child on a CAD pump, but there's not a lot of them. And so that particular training would be available and offered. So I hope that sort of addresses that, but really that's the whole point of training education, is to build capacity and confidence. And one more thing is that there are so many people in community who are already doing an amazing job looking after these kids, families who navigate crazy things to be able to support their child to go to school or to attend a program. And so there's already people who are doing this, but sometimes a bit of a boost in confidence is what is really needed. So it's not even that the basic training is not provided, it's that they don't have anyone to follow up with. They don't have anyone to call at midnight when they're trying to follow a care plan and they're trying to do the things that they were taught. They just don't, they need some extra reinforcement. And so that after hours support line, the care coordination service, and training and education is really intended to sort of meet those different needs of building capacity in community.
Terrific. Thank you so much. And I can't thank you both enough, Tessa and Tamara, for joining us today. I know that the center is of great interest to lots of people, and I really appreciate your generosity in taking time. I know you're both very busy, and sharing all of this with us. And I know people really appreciate the recording as well. For people, if we didn't get your question, I'm sorry. I hope that you wrote down the info email that you can contact at PHSA, and I'm sure you can get answers to those remaining questions. And with that, I'm just going to invite everyone to please join us for our next webinar, which will be Autism in the Emergency Department, Elevating Child and Caregiver Perspectives of Care. And this will be presented by our cluster trainee, Jade Campbell-Vine, and community member, Christine Nickerson, on October 9th from noon to 1 p.m. And Isabel has included information about that webinar and the link to sign up in the chat. And we hope to see lots of you there. I think that is also a topic that's of great interest to this community. So with that, we'll wish you all a wonderful rest of your day, and we look forward to seeing you next time.